Stay with us as we go into the next session, which is about the weed, medicinal marijuana, Jamaica's medicinal marijuana industry.
Welcome to our section on medicinal marijuana. I know that it's coming close to the end of the day, and so some of us probably may be tired. So I promise you that we're going to have tight time management in this session. The speakers have 10 minutes, and I want you to help me to monitor them, right? Because we want to get out of here within time. I'm Wendell Abel, I'm the moderator, and I will introduce the speakers before they come. Could we have the next slide, please? We have a slide. There's a slide. Yes. This is just a little brain teaser. What does that slide read? Very good, because, you know, sometimes when some of us look at that, we see opportunity is what? Nowhere. And if you look closely, it says what? Opportunity is now here. And when we come to conferences like these, some people come and they look through a different frame and they say opportunity is nowhere. And opportunity is like that. Even when it is staring you in the face and it's saying now here, some people are saying nowhere. And so this session, it's plenty of opportunity. The medical marijuana and nutraceutical industries are prime investment opportunities for diaspora members, with estimated earnings projected at US $300 million over the next 3 years. Members of the diaspora are already aware of the possible investment opportunity for the products and have initiated local partnerships. And so in this session, we're going to be showcasing what other opportunities exist and outline specific ways in which all of us, including Jamaicans overseas, can claim a stake in these industries. Opportunity is now here. Now, the first speaker is Professor Wayne McLaughlin, colleague of mine from the university. He's a career academic who joined the University of the West Indies as a lecturer in molecular biology. He's now professor. Over the years, his research has focused on areas of agricultural, economic, on areas of agricultural and economic and social importance to Jamaica and other developing countries. He's a prolific writer, and his publications total excess of 40 papers in international journals and presentation to scientific journals. He has advanced the frontier of forensic science in Jamaica, undertaken this extensive body of original work while shouldering the weighty responsibilities of heading academic department. He's a Silver Musgrave Medal awardee for science, 2001, Gleaner Honor Award for Science and Technology, 2010, and a Fulbright Fellowship. Let us welcome Wayne as he presents for 10 minutes. Thank you.
Good afternoon, everyone. Professor Abel has cut me down from 20 to 10, and he was saying 5 in my ears a while ago. I want to welcome you all, and of course, I want to thank the organizers for the opportunity to present today. My presentation will be looking at some of the work we have been doing in medicinal cannabis research, and this is basically University of the West Indies. Next slide. Oh, I can go ahead. Good. Oh. The red one, yeah. Good. Good. Right, so most of us here, of course, will know the product. And in Jamaica, we have many different strains, different varieties, and one of the work we have been doing is to actually look at the genetic diversity of what we have available. And so far, we have found that we have a very high diversity of cannabis that is grown in Jamaica, which is good in a sense that once we start looking at developing new strains for specific purposes, then the genetics is is available to allow us to do that. And of course, there are many different names given to different strains. We're not so sure if the different names are all one strain. And this is where our research is going, to look at how similar these different strains with the different names are in terms of the genetics. So since 2015, having gotten the order through the Minister of Science and Technology to allow us to cultivate cannabis, so UWI, we started immediately to set up a research institute, of course, which is headed by Professor Archibald MacDonald, which is the principal of the university, UWI. And of course, within the faculties, we actually now have a research group co-chaired by our chair here, Professor Wendell Abel, and myself. Some of the areas we have been looking at, of course, these are some of the opportunities and some of the basic research that's required. And public health, of course, is very important. And of course, Prof. Abel here will probably tell you that he has one of the first research grants actually to start that part of the program. The biochemistry, physiology, so this is the basic work that we have to do to understand what this industry will need and how to build the industry. So we're looking at plant chemistry, agronomy research, product development, training and education, testing, standards, of course, and validation of these tests, which is going to be very important if we're going to be making products for medicinal properties. And of course, clinical trials. That is something that we have to look at very urgently. So of course, there are many challenges. And this is basically based on the lack of understanding of the science behind cannabis. And being illegal for many years in many countries, this has basically stymied the amount of work that can be done in terms of the science and clinical evidence. So we really have to know, Jamaica, as you know, has legalized medicinal cannabis. So this is where we're trying to push the research that we can now look at these different strains and use this to develop medicinal products. So again, the challenge is that it's placed alongside heroin, and that is what is one of the biggest challenges because it's in Schedule 1, and we hope one day it probably will move to Schedule 2. So the research we have been doing at UWI, looking at the 3 different areas: basic research, applied research, and clinical research. So these are some of the opportunities that we're looking at in terms of getting other companies, individuals, scientists, universities involved. So the basic research, as we have started in terms of the genetics, which is really, really important. And as the bottom line is saying that we really need to look at getting a better understanding of all aspects of cannabis genetics. As I said, there's a wide variation out there, and we really want to narrow down the genetics to the particular clinical application. So with this industry, of course, let me get back. Right, with this industry, of course, the key thing is standardization. So if we're going to make a product, we want to know that the next day, we always have the same plant, the same extracts, having the same consistent in terms of the chemical, THC, CDB, and this is going to be very, very important for such an industry. So when we talk about opportunities, we really need to look at how we can develop such products and get others involved, of course, in developing such products. Right, so characterization. Here's some of the work we have been doing, looking at the genetics. As you can see on the left, completely different strain, and on the right, a completely different strain. So the one on the right is purple skunk. Everybody know that name? Right. So these are some of the different things we're looking at, and looking at how we can identify the different strains and put a genetic marker to these strains, because we are seeing that in time to come, each farmer, of course, would want to claim his strain, and again, legal issues, persons stealing X, Y, and Z. So this is where we are going with the genetics, that we can put a identification on each different strain for a different farmer. Right, so just to mention, apart from THC and CDB, other genes are going to be very important. Terms like disease resistance, how well the plant can grow, different soil conditions. So this is, again, another area that we're looking at. Just very quickly, genetic profiling is going to be key, as we mentioned. So these are some of the genetic work we have been looking at in terms of different markers. Well, I don't know if I can have a pointer here, but basically, we have been identifying certain genetic markers that can be used to identify different strains based on presence of those plants producing THC as opposed to those plants producing CDB, and of course those that are producing a combination, because we know in the medicinal use you're going to need some variations between THC, CDB, CDB alone, THC alone. So this is where we are going. The chemistry is going to be very important in terms of analysis. So we have validated, can you go back? Right, so we have validated different tests that are required. For example, you need to know how much THC you have, how much CDB you have, terpenes, other chemicals. So we have developed and validated different tests that we can profile different plants. And the idea is at the end of the day, we can develop a database of all the different chemotypes or chemical types of cannabis, because that's going to be, again, a key requirement for to develop the industry. Standardization, as I mentioned, is going to be important, and this has to be very key for different patients, because different patients will be at different age, of course, so different concentrations of different levels of cannabinoids is going to be very important to treat different diseases. So this is what we have been looking at, is how we can understand how this thing works. That is going to be key. Synergies between different products, terpenes, cannabinoids, again, are going to be key, because we know it's not just THC alone or CDB alone. Terpenes are important, right? That's what gives the cannabis its smell, that smell. Right? Delivery methods are, again, important. As you know, we are moving away from smoking. So how you deliver the product will be another opportunity in terms of developing different methods. Vaping seem to be, getting big, but things like suppositories, patches, how you get the product into the patient, right? That is, again, gonna be key. Right? So again, product development has to be important. So this is where we need industries to start looking at how to develop new products using the different types of plants or the cannabinoids that's present. Right? Delivery systems, again, we just went over that a while ago. I'll get to the end. The agronomy is going to be important, because we need to look at how we can grow this thing, either outside, in greenhouses, completely indoors. So those are some of the things we need to start to look at. Right? Clinical trials, luckily for Jamaica, again, many countries still prohibit clinical trials, and we do allow clinical trials in Jamaica for medicinal cannabis. So here's an opportunity, again, to look at new products being developed and to be tested using human subjects, essentially. Right. All right, I can move to the last slide. Right. So these are some of the diseases that some of the work has been done and published. So I need to colon cancer, leukemia, anti-inflammatory agents for pain, anti-tumor, neuroprotection. But here again, just to finish up, we can just go back very quickly. The opportunity, one more slide back. Right, so it's important that the government, researchers, growers, counselors, patients, we all engage to ensure that the authorities understand the positive side of the innovation. And of course, next one. So this is really an opportunity for Jamaica to write in cannabis into modern medical history. And very quickly, this is really slow. All right. Essentially, just to show some of the work I've been doing, from going through seed selection, germination stage, right through to maturity, and then extracting what's there and analyzing all the different products and standardizing the products. So I want to acknowledge our students, of course. They are the backbone behind all of this. This is Lindsay in Caritox, which is the lab that is set up to analyze and profile different strains of cannabis, and our master students in toxicology and forensic science. And thank you very much, sir.
Thanks very much. He did it in 10 minutes, right? He deserves another round of applause. And we thank Prof. McLaughlin, who has highlighted the opportunities in research and development. We'll have time towards the end in our Q&A to ask him questions. The next presenter is Hyacinth Cindy Lightburn, who's been the chairman of the Cannabis Licensing Authority since March 2016. The authority is an agency of government mandated to develop a legal, regulated, and sustainable medical ganja and hemp industry. Cindy is an attorney at law and currently a consultant at the firm of Duncox. She was called to the Florida Bar 2000, Jamaican Bar 2006. She's practiced in Florida and as an assistant state attorney before returning to Jamaica. She specializes in commercial litigation matters, defamation, personal injury, and intellectual property litigation. Let's welcome her to the podium.
Good afternoon, ladies and gentlemen. I'm going to speak very fast because, of course, of the time constraint. Okay. The first thing is that people need to understand exactly what the CLA is. The CLA is ultimately a regulatory body that is charged with dealing with the ganja and the hemp industry in Jamaica. We are under the Ministry of Industry and Agriculture, and our if you want to say our abilities come from the Dangerous Drugs Amendment Act. Our mandate is to create regulations to guide the development of an orderly legal ganja and hemp industry in Jamaica for the use of the plant and its byproducts by medical, therapeutic, and scientific purposes. You will hear me use those three words often, and the reason we use those three words is that there is a treaty which governs our ability of what we're able to do with ganja. And that treaty specifically says that the way in which we are actually able to deal with ganja is in those three categories. Second is obviously to ensure that the regulations created and activities within the industry are in keeping with Jamaica's international obligations. The international obligations are many, but the primary one, which is of most importance, have to do with the 1961 Single Convention with regard to narcotics. And lastly, to issue licenses, permits, and authorizations for the handling of hemp and ganja. Next slide, please. Okay, so that you understand exactly where we are. Currently, over the last year since we started accepting applications, there are 236 applications that have been made. There have been 44 conditional approvals. I'll explain to you exactly what that means in a bit. 2 licenses have been granted and no licenses have yet been issued. Now, just so you understand the distinction between granting and issue, if a person is granted a license but has not yet either paid the security bond or the fees, the license is not issued. So ultimately, for those 2 applicants, that is currently what we are waiting on. In reference to types of licenses, they're basically brought down into 5 categories: cultivating, processing, transport, retail, and research and development. Under all of those are broken down into subcategories. For example, for cultivation, you have Tier 1, which is under an acre, 2, 1 to 5, 3, above 5. Processing, above 200 square meters and below 200 square meters. Transport is as it says. With regard to retail, one is the dispensary aspect, which is what most people in North America actually know about. The second one is one that we have termed a herb house. We recognized that somebody who may have to ingest does not want to ingest at home. You may have children, etc. And because smoking in public is illegal, we needed to provide a safe space within which someone was able to consume. And finally is the issue of therapeutic. You're talking about a situation such as spas, etc. And finally, for R&D, that is separated into 2 categories. One is the experimental, and the second is for analytical. Now, the licensing process. The licensing process takes an average per applicant, I'd say about 6 months, and you need to understand why it takes that long. When the paperwork first comes in, there goes through a desk review process. At that point in time, for various reasons, it may be an automatic disqualification. If not, what then happens is that we verify the ownership and the employment details, we obtain banking information and police records. All of those documents, or the particulars in particular with regard to shareholders and directors, are then given to the various agencies of government who have to undertake due diligence. So example, FID, which is a Financial Investigations Division under the Ministry of Finance, PICO, the JCF, etc. So those departments have to then go ahead and do their due diligence, which usually takes an average about 3.5 months. Once someone has passed what we call fit and proper, at that point in time, the committee considers the application, and then a person is then eligible to have the conditional license approved. Now, what we realized is that it was unfair for anyone who was applying to sink money into the ground prior to finding out whether or not they would pass fit and proper. So once conditional approval is granted, we then give the applicant the opportunity to then put the infrastructure into the ground or to purchase, depending on what type of application that they have. And then subsequent to that, we then inspect the system for example, if you're cultivating it, CCTV, security, fit for premises, etc. And once that happens, then the license is then granted and then subsequently issued. Now, for the diaspora, the question is, what are the key considerations that one must have with regard to entering this industry? First is that there is a requirement that to apply for a license, the company or the applicant must be substantially owned and controlled, which means over 50%. And when I say over 50%, it could be 50.001, by a person ordinarily resident in Jamaica. The definition per the regulations of what an ordinary resident is an individual for the purposes of the license is one who has lived in Jamaica for 3 consecutive years, immediately preceding the date of the application is at least 18 years old. Now, with regard to attractiveness for investment, there are a myriad of business opportunities that are arising as a result of this industry. Well, the first one is the obvious with regard to local and direct investment with regard to just the fact of people entering and doing the industry, meaning those who have applied for the licenses. What we have also seen is a lot of value-added services, consultants, etc., that have come about as a result of the industry. The second one, obviously, Dr. McLaughlin just spoke, had to deal with the issue of clinical trials. You have medical tourism and the value chain in relation to that. We have asked the Ministry of Health to go ahead and give us ethical consideration for the clinical trials so that we are able to make sure that it goes on in a particular manner. Demand push from the provision of medical permits to tourism. Now, whereas in Jamaica, for somebody who lives here, you have to get a recommendation by a doctor, we recognize that, in particular, if you were coming from overseas, you needed to get what would be your way in order to be able to partake in the industry. So ultimately, you will be able to get a permit while you are here in order to go ahead and partake in the legal cannabis industry. So obviously, that increases the size of the market that you are able to access from just the local market to the overseas tourist market as well. Obviously, through our efforts, we are trying to shift from the illicit trade of the industry, which unfortunately we have a reputation in that regard, to a legal industry. So we're trying to change the global reputation, and there are also the added benefits with regard to the socioeconomic benefits of commercializing ganja. Also create a reputation for value-added medical research, just to highlight further on what Dr. McLaughlin said, and breakthroughs in pharmaceuticals and nutraceuticals. If you had seen the video earlier, in particular with Dr. Henry Lowe, that's a very good example with regard to that. What are the challenges? One is that obviously, as everyone knows, with regard to ganja in particular, Jamaica has a very high risk profile. That is something that is going to have to change over time. The second issue that we are having at the moment has to do with the banking of the industry. As you know, all banks in Jamaica, in order to be able to send money abroad, they have to have correspondent banking relationships, and primarily it's out of New York. And because ganja is illegal on a federal level, this presents a problem for banks. We have just to let you know what we have been doing, we have spoken to the BOJ, we have spoken to the Bankers Association to try and get a system that will work, because obviously the last thing we would like is a cash-based system. Finally, the issue of adequate and proper land titles. Everybody kind of knows the issue of deadlift. The problem, either A, somebody hasn't left a will, B, a will has not been probated, and even though you have lived on the land for X number of years, unfortunately the question is who actually owns the land. We have been working with the National Land Agency, and also they have the LAMP program in order to try and facilitate people who wish to enter the industry to use that land in that process. So finally, just to say we are committed to a responsible ganja industry, but if you are interested particularly in this industry, I recommend that you go to the website, which is cla.org.jm. On that website, you have all of the information, the application forms, the regulations, as well as terms and conditions and all the things that need to be complied with in order to be able to partake in the industry. So thank you very much.
Thanks again. We're doing very well in terms of time. Thank Cindy for a very informative presentation. Our next presenter is Dr. Ellen Campbell-Grizzle. She's currently Associate Professor in the College of Health Sciences at the University of Technology here in Jamaica. She's a researcher, behavior change, communication specialist, and registered pharmacist with over 40 years' experience in the public and private sector of the pharmaceutical industry. She's previously served as a Dean of the College of Health Sciences, UTEC, between 2011 and 2016, and she's currently the university's focal point on its herbal cannabis enterprise. We invite her to the podium to make her 10 minutes pitch. Thank you very much.
Is this working? Yes. That one? It's not working. Yeah, it is. Not working. Okay. Thanks. Ladies and gentlemen, members of the Jamaican diaspora, welcome home. Welcome home, man. Good to see you. Good afternoon. Let me just thank the organizers for inviting UTEC Jamaica to be a part of this dialogue. And let me take you briefly into the presentation very quickly. Next slide, just give you a bird's eye view of our nursery at UTEC Jamaica. We have an experimental plot where cannabis is grown. That plot is operated by Ganja LLC on our behalf. And we also have another investor at UTEC here on the panel as well. Mr. Betty is one of our investors as well from Timeless Herbal Care. The next slide. The medical cannabis industry is described as green. Forbes magazine says we're at $6.7 billion US dollars this year. We're going to go to $20.20 billion US dollars in 2021, annual growth rate of 25%. And yet, the pharmaceutical industry is not investing as we would expect them to. And the reasons are this perceived risk, next slide, risk and uncertainty. That's part of the industry in the United States. However, next slide, please. It opens up the opportunity for investors, small, medium, and large investors, to come into the industry, to come to Jamaica, and to invest. The U.S. has problems with scheduling of products. There are problems with what the legislation is going to be going forward. Now that has opened up an opportunity for you to invest in cannabis, medicinal cannabis in Jamaica. Canadian investors, people from Israel, they're all coming to Jamaica now to be part of this industry that is expected to grow exponentially. And we are offering at UTEC some opportunities for small, medium, and large investors. Please recognize, next slide, that Jamaica has sorted out scheduling problems. We've scheduled Asmussen and Canazole for over 20 years. And in fact, when you're scheduled here in Jamaica, pretty much you're scheduled in the rest of the Caribbean, because we are the gold standard for scheduling in the Caribbean. So the Ministry of Health has a very good operation in terms of scheduling. There are other advantages. Next slide. There are other advantages. Of course, you know that, as Professor McLaughlin said, that universities are allowed to engage in research and development on the ministerial order at the moment. We have applied also for CLA permission as well to engage in further in industry. The geographical location, sun all year round, soil, and we have folks who are very familiar with the growing of cannabis and whose wisdom is not to be discounted. However, they need some help in terms of the technologies and so on to raise it to the next level in terms of medicinal cannabis. And there's the mystique of the Jamaican cannabis, the essences and the active ratios that are unique and uncommon to our cannabis. In terms of UTEC, we have been innovating. We really have taken time to study the box, and we are now thinking out of the box within the confines of our regulatory permission. And we are willing to take some calculated risks within those confines. And of course, like all Jamaicans, we have just imagination that knows no bounds. We are very creative and imaginative people. And our potential investors, to share with you, come from all over the world. But of late, we've been getting some second-generation Jamaicans from the United States who really want to come home. Many have made money in the tech industry, and they want to come home and get a piece of the medicinal cannabis industry here. And we've met with them. There are some academics working in huge labs in the United States where sometimes the permission is not there for them to do the research, and they want a little lab where they can come home, tutor some students, and get some work going and earn their patents. And university benefits, they benefit. And also out of the UK, we are getting some queries about Jamaican CDB and the Cayman Islands as well, saying that there is some demand for the Jamaican CDB. And so we have to look into that as well as areas for investment. We have some investors who have been very useful, like Timeless. They want partnerships. They give you scholarships for students. They want to barter technology for, at the end, out of product development, they want a share of that. They want to in terms of help you to build labs, to get benefits in terms of giving us some money to do labs and world-class facilities. Interestingly, we have a partner who has given us a seed-to-sale technology so we can tag from the time it is a seed to when it is being sold, so we can actually have a tracking mechanism in terms of from the time the plant is sown to the time that it is up for sale. Again, another picture of our grow. This is another view, more mature plants. Of course, I couldn't bring any for you. I was not given any permission to do that. No demonstration tools. But I would have liked for you to have a sense of what. But many of you may be familiar with cannabis sativa. And but at UTEC, we do have it under some tight control. And so I didn't get the permission that I wanted to give you some samples. We've been leveraging our strengths. We've been working in terms of our product formulation strengths for the last 40, 50 years. We've been working with pharmacists to build products, to do products. So in the area of medical, nutraceutical, cosmeceutical, and other product formulations, we've been working on that. We have a multidisciplinary approach. So when we sit with our clients, we have the engineers, and we have the health scientists, and we have the nutritionists there, depending on what your need is. And we offer you investments based on your perspective and your pockets. So you can be a small investor, you can be a medium investor, you can be a large investor. Just depends on what your pocket is like. So what have we done? We've signed MOAs with private and local and international partners. And at the beginning of our discussion with them, we really emphasize the need that there must be some give back to the communities that we are going to work with. Many of these communities have already paid the price for this industry to be where it is, and so we really insist that some give back is there in terms of the investment. New products, we're working on some pain management project with some of our investors at this time. And we have also a MOU, Memorandum of Understanding, signed with Steeple, one of the larger testing centers in California and the United States. So we use their technology in terms of testing. We have a quick and easy test, 5-minute levels of CDB, THC. Of course, if you want more robust tests, then, we are able to do that in the labs across UTEC, or as Dr. McLaughlin is saying, UWI is also able to help you in terms of that sort of testing. We've had 2 medical cannabis integration days, and they've been successful. We are going to go international with that today, every year, and we've started to manufacture what we call eco-friendly accessories to support this herbal cannabis industry that is growing. Please donate. We encourage philanthropy. We want to build labs. We want to set up our research and innovation center. We want to do so many things, and we cannot do it without your support and your donation to the University of Technology, Jamaica. We need lawyers who are experienced in international matters and who can help us with the knotty issues of patent development and all of that. We need international marketers. We offer cultural immersion opportunities to people from abroad. Where they come, sit in the classroom for a day or two, we take them in the field for another day or two. So you bring us some clients, we talk commission. We really, really, really want to get more people coming to Jamaica for this experience. In terms of lab techs and pharmaceutical techs, we are training some of those, but we are going to definitely need some more of those. And of course, we need clinical research partners. So we are testing at the moment. We are consulting on product registration. It's a strength at the university. We are consulting on business development and medicine prototype development. We are actually engaged with some of our partners in developing some prototypes for them. Our next slide takes us to some of the innovators from our university. You may know them well. These are world-class athletes, started with very research-constrained circumstances, and today they're the best in the world. And so we're inspired by them. We are going to follow their example in terms of how we roll out our business at UTEC in terms of research and development in the area of medical cannabis and herbal medicines. So we are creating this Research and Innovation Center, and we are looking forward to your support. Let me wind up. Next slide, please. Next slide. Right, let me just wind up because there are going to be questions, and I'm anxious to hear them. Just say that at UTEC Jamaica, we are trying to create, and we will create, inspired by the spirit of some of our athletes. We will create a steeple of excellence, quote unquote, in cannabis and herbal medicines research and innovation to earn wealth, achieve sustainability, and enhance national development. I can be reached, and we are open for business, I can be reached at ellen.grizzle@utech.edu.jm. And so you can give me a call also at on my cell phone at the moment because it's easier to get me on the mobile. So it's 815-5104. Thank you for your attention.
Thank you, Ellen, for that presentation. And you notice she emphasized how she can be reached. She's ready for business. The next presenter is Courtney Betty. Courtney is president and CEO of Timeless Herbal Care International, and he's played a leading role in the deregulation of communications in Jamaica, where he served as senior legal counsel at the Jamaica Fair Trade Commission. He has over 20 years' experience within the legal, regulatory, and business environment. Began his legal career with the Department of Justice in Canada by prosecuting tax, commercial, and civil cases on behalf of the government of Canada. His expertise, he has vast expertise in working with governments and private sector combined with an in-depth knowledge of emerging markets and brings tremendous value to Timeless. I know my friend Courtney has a lot to share with us, but he has 10 minutes. 10 minutes. Welcome, sir. Give him a hand.
I'm going to blame it on the clicker, first of all.
Point to the red button above the man head.
Okay, let's see if it's, it is. All right, good afternoon. As Professor Abel has said, after 25 years of being involved as an attorney in different levels, 4 years ago was kind of interesting. I remember I was at the University of the West Indies having the first conference in medical marijuana. Dickie Crawford was there, and a lot has happened since then. It was interesting because the presentation I gave then and the vision I had, it's not much different from what you're going to hear today. I really think that, as someone who loves Jamaica, and you're here because you love Jamaica as well, I think that one of the key elements that we always has to remember is about vision. And I always begin a lot of my presentation with Proverbs 29:18, where there is no vision, the people perish. At the presentation I gave 4 years ago, I also utilized a quote from Marcus Garvey: "A people without a knowledge of their past, history, origin, and culture is like a tree without their roots." And the reason it was important that I used that is I felt that this industry was going to explode. But I thought if we exploded and we didn't understand what we're doing and where we're coming from, we're going to make a mess of it. So we look at all the things that have happened in Jamaica. You look at coffee, you look at reggae that Japan now owns, you look at bauxite, you look at sugar. We've had a lot of great, amazing opportunities. You know, it's interesting, I was reading an article in The Gleaner. They talk about we had some special minerals and all this other stuff, and it's always happening. We keep hearing about all these great things that are happening for Jamaica, but you look at our country right now and you can see that we never did achieve them. Medical marijuana really has the opportunity to be that solution for Jamaica. I strongly believe that, and that's why I've invested the last 4 years of my time in trying to move this industry ahead. And Dean Griswold mentioned it's predicted to be the largest industry the world has ever seen. Some people say it's going to be bigger than cigarettes and alcohol combined. When you start looking at the pharmaceutical implications, it's going to be a huge industry. And it's happening all over the world. Jamaica is on one level, but if you look at Israel, I visited Israel over the last 2 years, their conferences, they're the world leader. They've got over 100 clinical trials happening in Israel right now that they're testing medical marijuana products. In Ghana, we've just partnered with a group out of Ghana to replicate. The government of Ghana is now looking at implementing medical marijuana. The United States, you've got the states that are there. Australia has moved ahead. They're now conducting clinical trials. Canada is now moving ahead with full legalization next year. So this is an international movement. Where do you tie in? The diaspora is really about knowledge, experience, and all the other things that you bring. But of course, Jamaica, we're also going to need a little bit of money, and your money remittance will come in handy. It's kind of interesting because we were the first country in the world actually to have a medical marijuana program. Nobody kind of remembers that. In 1984, the laws in Jamaica excluded medical marijuana from the definition of ganja. We took advantage of that through two incredible trailblazers, Dr. Lockhart and Dr. Manley West, who went out, they did a lot of research, and they came up with two products, Canisol and Asmasol, Canisol for glaucoma, and Asmasol for asthma. Now, it's interesting, because if they were in the United States, they'd be sitting on about $2 billion, $3 billion. Now, unfortunately, at the time, they did not have the support of the local environment. So what we've done is timeless. We want to build on the past in terms of the work that's already been done by these great pioneers and others, but we also want to recognize the mistakes that we've made in the past. Special moment for me being an attorney was planting the first legal plant in Jamaica in 102 years with the former Minister of Justice, Mark Golding, who I'd worked along with in trying to shape the legislation for Jamaica. Some of our accomplishments as a company, last week our greenhouse was certified. It's the first quarantine-certified facility for growing cannabis in the Caribbean, and we're very proud of that. The University of we're the commercial partners with the University of the West Indies. We're the commercial partners with the University of Technology. Our partnership with the University of West Indies we signed 3 years ago. We're the first commercial partner because we actually believe that if you could create an industry that was focused on medical products, then the opportunity for Jamaica is limitless. We're very proud we've created a model working with UTEC and others. We brought on Dr. Lawrence Williams. He's our chief scientist, I think the top scientist in the Caribbean, former head of the Scientific Research Council. We worked along with him, took his 24 years of research to a level where we now have a product which is certified by the Ministry of Health, the guinea hen weed. Many of you may have heard that he got a patent last week in the United States, showing tremendous implications. Very proud of what Dr. Williams has done. Our goal is really about partnership. We want to build partnership. We're partnered with Open Vape, one of the largest companies in the United States. Very proud of our partnership with Mount Sinai Hospital in New York. I was in Hong Kong last week. Dr. Abel would have enjoyed it, where we had over 100 individuals and top researchers in addiction that were gathered in an amazing presentation by Mount Sinai as to how cannabis CBD is now being used to treat heroin addiction in the United States. We're also partnered with the National Black Chamber, which is doing a presentation there on this Saturday. So again, we've built a company on partnership. Our vision for Jamaica, create some really, really good medicine. We have the ability, we've got the researchers, we've got the history, and then to be able to export that to the international marketplace. One of the challenges that I've had, and my challenges I've seen in Jamaica, is this association with ganja and medical marijuana. And so we need an educational program. Everyone thinks of, as soon as you mention medical marijuana, the first thing that comes to mind is a spliff. And this is so far from the truth. If you look at some of the companies in Canada right now, there's about 7 companies that are publicly listed. The highest one is about $1.8 billion. The lowest one is about $300 million. These are companies that are publicly listed. You look at GW Pharmaceuticals in the United States, that's a $2 billion company. So the opportunity for Jamaica is utilizing the universities, Wayne McLaughlin, the great research that's been done, getting investments across the board from people from the diaspora and others, and being able to produce amazing products that are helping to build communities. We've just partnered with the Jamaica Bauxite Institute. We've got about 50,000 acres of bauxite land that's now sitting there that represents a spoil for Jamaica. And we're trying to figure out how can we work with communities, invest in these communities, reclaim that land, grow not only potentially medical marijuana, but also different forms of herbs. So I know that there will be questions, but I really hope that you as the diaspora, you come back and you participate in this. Because otherwise, others are going to be jumping on board, and we have to now not make the mistakes that we've made in the past, reclaim our destiny, and I think medical marijuana is the product that can do that for us. Thank you very much.
Wow, Wayne, great. Sorry, Betty. So let me thank the speakers again. They did it. They delivered on time, and I think they were all very clear and succinct in their presentation. But in listening, I can't help but reflecting on the fact that Israel is world leader, Ghana is getting in the business, Canada, full legalization next year. A question I'll pose, is the window of opportunity closing on us? Opportunity is now here, right? And it's time for us to grasp. At this point in time, we're going to open the floor to questions and answer. How much time do we have, Professor Ying, for Q&As? 20 minutes. So we have a lot of time because we've utilized our time very well. So let me start with you, ma'am.
Thank you so much. I'm very excited and hoping to see how we can certainly form partnerships with everybody up there. I have a question. Last year we had, last November when we had our agriculture conference in Washington, we did a session on Capitol Hill on medical marijuana. So this question is about the big issue, which is the finance and the banking chain. What is happening and how can us in the diaspora, working with your counterparts in the US who are trying to get the federal laws to match up with state laws so you can have trans-state border crossing of the financing, how can we help be the voice for that so we don't further exacerbate the fintech and the correspondent banking challenges we already have? Option 2, have you looked at blockchain and alternate financing as a way to go around that problem if we had to do it? How can we be helpful in advancing that? And other folks, I will hopefully catch up with you of how we can partner.
In reference to the first part of your question, it's difficult to know. With the current government of the United States, the laxing of those laws with regard to ganja seem very unlikely based on the rhetoric that has been said in the open space. Jamaican banks, their correspondent banks in New York, those banks are their lifeblood. So until I believe the Jamaican banks need to get together and put their heads together in order to figure out, well, what are our options? And then once they figure out their options, their advocacy is going to come with regard to the Bank of Jamaica, and then further on with the Ministry of Finance to the United States Treasury. That's the primary. In reference to alternative ways of providing financing, one can always provide financing in whatever way you see fit. The problem is the banking of the industry at the end of the day. When a man makes $1, rather than putting it under a mattress, he wants to be able to go ahead and put it in a financial institution. So until the local banks actually reach a consensus with regard to how they themselves are going to manage this industry. Unfortunately, all we can do is push them to move forward.
Okay, thanks. You may go ahead. Thank you very much.
Doesn't seem. My name is Nancy George, and I'm a Jamaican. I was born in Canada, but I live in Jamaica. I just was interested in knowing, there's lots being said about marijuana, but this was supposed to also include the hemp industry, and I haven't heard anything about hemp and the advancement of hemp and its industrial possibilities.
We are currently in the process of drafting the regulations for hemp. The reason we had to do this in a very systematic approach is because hemp that is planted too close to ganja breeds the possibility of cross-pollination. So what we thought was the best way to do it was to get the ganja industry up and running. We are currently in the process of seeking advice with regard to the hemp industry, with regard to the sex of the plant, etc., whether or not it has to be done specifically indoors, because unfortunately we live in a small island that has hurricanes. So the possibility of cross-pollination is high. So what I can say is that we're hoping in the next year that the hemp regulations will be out.
Thank you. Ma'am?
Well, one of my questions was asked just now.
Okay.
Although I had a different way of framing it, so I will reframe it. What are the waste products? I'm really interested in agricultural waste and how it's dealt with in Jamaica in general, because it represents an opportunity to combat climate change and to produce additional streams of income for the business owners. And the other one is inclusion. How do you keep and include the small? I mean, what you've mainly talked about is how to construct barriers to entry, which is great for Jamaica against the rest of the world. But in terms of barriers to entry for those small people who don't have the funds to, to put in place the security measures, to apply for all the, to jump through the hoops, how is this industry going to trickle down to the small man, the small farmer who might have a half an acre? So those are the two questions. Agricultural waste, I was assuming maybe that could provide secondary industries in hemp or textiles or energy production or other things. I'm not an expert. But
Okay, excellent question.
Okay.
I'll start with the waste product. We're hoping that the industry will have zero waste. So we're looking at all aspects of the plant to be used. The leaves,
medical,
the stems,
okay.
the roots. Then if there is waste, in a sense, that we hope to look at mulching, using that residual to be put back into the field. So we're looking at all aspects.
In reference to the small farmer aspect, when the interim regulations came online, we did a tour around Jamaica in order to speak to the small farmers. And subsequent to that, what we were able to figure out is that under the United Nations protocol, we are able to do something called an alternative development program. We sought permission from Cabinet. An alternative development program in this circumstance is actually a community monitored effort. Cabinet has allowed us to have a pilot project with regard to 2 AD programs in the country. We met with most of the representatives of the advocacy groups and small farmer organizations. From them, we came up with a committee that's going to come up with a list of criteria, and ultimately we will be accepting applications to find the 2 best groups that will give us the greatest likelihood of success. The foundation of that AD program is ultimately that a farmer is able to grow a half an acre, enough to go ahead and feed his family, and the product that he grows ultimately goes into the regulated stream. So that is currently being worked upon.
Okay, thanks. Sir? Oh, sorry, go ahead. Jay.
Just in response to your question, because I think it is really a critical question for the industry. Our mantra is from sharecroppers to shareholders. And I think it's really critical that we begin to wrap our minds around how these farmers participate in the value-added element of the industry. Because if they don't, they're just going to be sharecroppers. Our partners, for example, in California, Open Vape has an amazing program. And so what they've done is they've worked with individual farmers in California, but they now allow that farmer to have his own brand. So this farmer his product, his name, etc., is going out. And I think we've got to kind of look at situations in Jamaica. First of all, how do we promote these individual farmers, allow them to develop their own brand, their own products, their own value added, but also critical as these companies begin to come to Jamaica, these farmers need to be shareholders in these companies. Otherwise, we're going to recreate the plantation system.
Sure, go ahead.
Just what Courtney said is extremely important, but just to add on one other thing. One other thing that I'm very cognizant of is that there is a lot of influx coming into Jamaica of people who want to speak to farmers and ultimately take away their traditional knowledge. And I have implored the local farmers to be very careful, because what they have has a value. What they know has a value. With regard to the branding issue, that has to be an industry-driven process. And I put it to all members of the market that with regard to geographical indicators, the setting up of their own brands, etc., I believe that is also going to be critical in order to ensuring the value of whatever somebody is producing. So if you are somebody who is willing to get into the system, I ask that you join with other people into one, trying to see if Jamaica can get a geographical indicator for ganja, and two, to educate those farmers with regard to setting up their own brands.
Thank you. Sir?
Good afternoon, everyone. Thank you for coming and spending time with us. Marlon Hill, attorney in Miami. This question is for Cindy. Michael Lichin was here with us this morning, and he was talking about the drivers and inhibitors of economic growth. One of the inhibitors of growth, in my opinion, on many levels across the spectrum of Jamaica and the diaspora, is our culture, as how we look at things, how we view things. And I think the image of ganja is something that is an inhibitor among our people in terms of, hands-off kind of thing. I would like to know from you, Cindy, how much resources will be dedicated from the CLA or any of the ministries that are affiliated with the CLA in regards to a marketing campaign to educate the Jamaican public, because everyone's looking to Jamaica. We already have a brand without even marketing it, because everyone's looking at that our cannabis has some special magical powers. And it may, right? But from an image standpoint, I think our entire culture needs to be recalibrated, as one of the words used this morning, as to how we view cannabis, ganja, weed, cali weed, whatever the words are. So we need a marketing campaign. Where is this going to come from? Can we get the Parliament to dedicate some resources? Because it's not only connected to the Ministry of Commerce, it's connected to the Ministry of Tourism, it's connected to the Ministry of Youth. And because the delivery method, the state where I come from, they still have a stigma as to the delivery method of smoking and split, like Courtney said, right? There's several types of delivery methods, and it's not just smoking. And there's a lawsuit in the state of Florida fighting to get that back, because they approved medical marijuana, and delivery method includes smoking. So could you speak to that, please?
Unfortunately, our marketing budget right now is not that large, and that is primarily because right now we are trying to set up the regulatory system. Until I have a regulatory system that the international community can look at and say that it is foolproof, that has to be my primary focus at the moment. Our marketing and I wouldn't necessarily our marketing, I'd say our communications campaign has to do primarily now with the misconception that's happening with regard to ganja in Jamaica. In other words, I think that when the law was initially rolled out, everybody kind of said that weed has been freed up and everybody was happy, and then all of a sudden we had to re-educate people with regard to the separation of what was recreational versus what was medicinal. And so ultimately that is what we have been dealing with at the moment. But I do take your point that in terms of an adequate marketing campaign, we are going to need funds. But unfortunately right now with the list, it's not in the top 5 at the moment.
Okay, thanks very much.
I think, we also have to recognize that Jamaica's brand is actually potentially a problem for us. This association with ganja is our greatest obstacle that we have to deal with. And, when I started in this 4 years ago, I was not fully aware of the medical benefits. And recently, the Minister of Health, he spoke about his views on smoking. I was attending a conference that looked at the development of the human brain for young people under 19 years old. So there are some very serious considerations that we have to balance here in Jamaica. But if we begin to characterize this as a medical industry, following along the path of Dr. Lockhart, Dr. West, and building on those products, that might be one way of starting to change people's perception, where you can actually see real results and products happening in the marketplace.
Okay, thanks. I realize the queue is getting longer. I'm going to close it. And what I'm going to do is just take the questions, we'll note them, and you can sit. It's also polite, so we don't have you standing on your feet for too long, right? So I'm going to zigzag in order. So, sir, you first, and then we come to you, and we end with the gentleman behind you. So you can just note your question quickly, and we'll record it.
Good day, ladies and gentlemen. My name is Shaquille Sayers. I'm from Canada. Well, it's not much of a question, it's more of a statement. I have a vested interest in the cannabis industry. I didn't hear you guys speak about the endocannabinoid system, which it connects to the central nervous system and the peripheral nervous system of the brain, which deal with the pain, sensation, and the mood, and all of those type of things, which only cannabis can help those receptors and cure that feeling. I never heard you guys speak about that. I'm just saying that.
Okay, well, thanks very much for pointing that out. I don't know if we have to further comment on it in the interest of time, but we'll note. If we get an opportunity, we'll do that, right? Promise you. But we'll note that if we need to elaborate. Thanks very much. I realize you're a young man. Thanks for being here. Thanks for participating. Next, please.
Yes, good afternoon. My name is Stephanie Ardrey. I'm a principal at Blue Diamond Capital. We're a real estate development company and investors. And so you touched on medical tourism, which is an area that I'm very interested. So I'm wondering if there's any additional comments about the use of medical marijuana in the medical tourism space.
So your question is about medical tourism. We'll come back to that. Okay. Next person, please.
Good afternoon. My name is Marie Kellier. I am the alternate advisory board member for the Midwest USA. I live in Los Angeles. I'm a producer. I wanted to just touch on the whole idea of education, because actually I took out my computer and started working on catching up on my emails, because I really wasn't that interested in this session. But as I heard the information, I realized that I'm also an educator. I do marketing. And so I realized that there is probably a space within this industry where my skills could fit. But the thing about it, I keep hearing the young lady in the middle, I forgot, I can't see your name from here, but you keep referring to it as ganja, all right? Whereas the other panelists are referring to it as cannabis. And therein, we are not even sure, it seems, what our branding is or what we're actually putting out as our product. It's been noted that there's some issues with the word ganja and the perception in Jamaica. So it seems like we need to kind of have a conversation about that as we roll out this pretty new industry that some of us may not warm up to immediately, but may eventually find a place that we could actually get on board.
All right, thanks for that question. It's about education, possible role for educators, the need to brand our product, and to clarify ganja, cannabis. We'll come back to that. Sir.
Yes, good afternoon. Courtney Lewis here from Tancor Trade Union. What it is, this thing is a big fish, and we have a liquor boat trying to get a big fish in a liquor boat. That's what is happening here. What is it if we don't know what we're doing, we'll just lose all of this thing? One, the geographical area. Two, the structure, financial structure. We don't control capitalism. It controls us at the moment. And we have to find a way how we can know the country, not the geographical area. So we need a trust fund to do the business, not the banking thing, the trust fund. The government need to set up a trust fund where these people put their fund and the central bank do the transaction thereafter with the international body. That's what we need to do. The next thing and the biggest problem, the small people who carry the brunt of the thing, we're leaving them out. Yes, we need to regulate rules around them. We send that, we draft that thing we fix that thing and send it. They should have worked with it, what we have sent. So the small people don't be left out, because if the small people, like who do the trade, it become a culture of them doing it that way. We won't stop this gun for junk trade, and that is the biggest problem. If we don't have peace, we can't have business. And we need to find a way to regulate the thing with them within it, not leaving them out. So these are the biggest problem. We need to sit, I won't take up the whole time. So everybody.
Excellent point, sir. Thanks very much. And it's about trust funds versus banking, role of the central bank, small people leaving them out. We'll come to that point. You, and then you, sir, and then that's it.
Yes. Thank you, Dr. Abel.
Sure.
Michael Barnett here. As somebody who is familiar with the situation in South Florida and here in Jamaica, I just want to make the contrast that we in Jamaica need to follow the trends that is happening, the dispensaries that are now set up in South Florida. And also we need to include Rastafari, I think, more in the industry here. I would like to know how many Rastafari are on the CLA board, for instance, because Rastafari, without anyone saying it, are responsible for the branding, I would argue, the strong branding that we have in Jamaica. But there seems to be the de-Rasticization of the marijuana industry here. No one wants to speak to it, but I will speak to it. And but it's Rastafari, ironically, who is branding the marijuana here. So I would like to see them incorporated in this discussion. And I'm wondering just how much influence does Rastafari have with the CLA and the granting of licenses? Because ironically, in South Florida, I can speak highly of Dr. Hall, who is a medical Rastafari doctor, has a dispensary and so forth. Rastafari brethren here are struggling to emulate the same thing here in Jamaica. It should be easier here than in South Florida. So I'd like the panel to speak to that.
Thanks for raising those great points. And it's about dispensing, ensuring that we include the Rastafarians and how many of them are in the CLA. The point is, not left out the rest of them, right? We have to make sure we safeguard about. So we'll come back to that. And yours, sir, the last question, and then we will address all of them.
My name is Lyle Young. I teach in Minneapolis, Minnesota for the last 26 years. I've been in teaching for 40 years. I'm from Granger, Westmoreland originally, where the great Peter Tosh came from, where he was born. He sang the first song about legalizing marijuana in Jamaica. Let's give him some kudos. Now, my point is, question I should say, are why can't we start a cooperative system to help the small farmers get together and organize themselves? They'll be stronger together. I close by saying there's an African proverb that says, if you want to go fast, go alone. If you want to go far, go together. Thank you.
Thank you very much. Excellent questions and point. Thanks a lot. So we will now try to answer these questions. The first one is about medical tourism.
The Act gives, well, the regulations permit, as I indicated before, a tourist to come in and get a permit, as well as to go ahead and partake in the industry. So the opportunities there, in addition to having your own herb house, is obviously the situation of ecotourism, as well as the issue of medical tourism with regard to treatment. So that's the short answer for that one. If I could just address some other issues
Sure, absolutely.
In reference to ganja, that lady was absolutely correct. The reason I actually use that interchangeably is that if you travel around Jamaica and speak to the farmers, they are very clear. They grow ganja. So that is the reason why sometimes, in particular with the CLA, that word is actually used interchangeably. In reference to the gentleman with the Rastafari, two actually Rastafarians sit on our board. One is from the Ethiopia diaspora. The second one is Ras Ayavi, who's the head of the Westmoreland Ganja Growers Association. So their participation and their commentary is integral to the way in which we operate. Just to add a little bit more about the Rastafari, though, I think it needs to be separated into two issues. There's one which is the commercialization of ganja that is grown by Rastafari, and then there is the issue of sacramental. The CLA does not have a remit for sacramental. That is governed by the Ministry of Justice. So for example, if people are having permits for events, etc., all of that goes to the Ministry of Justice. The gentleman who asked about the cooperative system. Yes, you can apply as a cooperative. The regulations do provide for that. The one restriction with regard to cooperative is that the lands have to be contiguous, which means that they all have to be joined together. You can't have 50 parcels of land all over the country. So we do have people who have applied in a cooperative nature, and that has actually been very economical for them because it is one application form that actually has to come in. Yeah.
The banking issue, trust funds versus banking.
Well, for the trust fund issue, that's an issue for the ministry. What you're saying is that the government should ultimately set up a trust fund. I don't necessarily know, with all of the financial considerations the government has at this moment, whether or not it is able to do so. With regard to the suggestion that was posed, with regard to kind of, I believe, have almost a facility that did, a central facility that did the banking. The problem is that even all financial institutions in Jamaica are ultimately governed by the Bank of Jamaica. So even a credit union banks with a commercial bank who ultimately is governed by the Bank of Jamaica. So therein lies the problem, which is why I say that the banks have to get together to go ahead and solve the problem. I believe that for them, there is a lot of opportunity for them to earn in this industry. And so I do believe that if you want to say, the carrot is in front of them in order to find a workable answer as to how to bank the industry.
Thanks very much. Before you go, Professor Ying wants to make some important announcement, and I have one to remind us that the Faculty of Medical Sciences, UWI, annual research conference is in November this year, 2017, and we'll be looking at cannabis and cannabinoids, opportunities and challenges. Thanks very much for your participation. Thank the panelists. Have a wonderful afternoon. Professor Ying.
Give the panelists a round of